Welcome to Black Health Matters. I'm Darryl Armistead, your host. This episode is a Zoom recording of Howard University group session led by Dr. Clive Callander.
They break their bones. And these broken bones can lead to many other problems that not infrequently wind up in the death of the people. So that it's important to find out if you have osteoporosis and prevent getting a fracture. And of course, the most important thing is to have exercise, keep your muscles as strong as possible. Then there's an article that also talks about the falls that you have when you're over 50 and how important it is to take care of them right away before they can lead to more severe consequences. But I think they also reemphasize the importance of exercising, weightlifting. So I think it's good information to have, and I think that the other thing they talk about is if you fall, how important it is to take care of yourself if you fall, and how important it is to get rehab if necessary, and also to use those things that help you to be confident, whether it's a walk or a cane or whatever it is that gives you confidence as you get it. But so is avoiding, we've talked about that in the past, but I think it's good to be reminded time and time again of the significance of, as you age, that there are certain things that go along with the aging process. And one of the things is osteoporosis and softening of the bones that is treatable. And that when that is combined with exercise and weight bearing, it minimizes the likelihood of you having breaking your bones when you fall. Okay, I guess we can put up the first.
Before we go to the first slide, the reason why it affects women more, is that because of the relationship with the decrease in estrogen?
That's what they postulate. They hypothesize that, yeah. And they think that that's why women have 4 times as often osteoporosis than men, and why they, yeah. But they think the loss of the estrogen is part of it.
Okay, thank you. Okay, I'm going to go to the first slide. Give me a second.
Darryl, in Chicago, do you guys have any effect of the haze as a consequence of the Canadian wildfires? No, okay.
No haze out here.
Okay, in the East, we're very much victimized by it.
Sorry to hear.
Yeah. Well, this is something that we've talked about, loneliness, and regardless of the cause, it's something that is causing havoc in all ages. Of course, it's increasing the suicide rate in teenagers as well as olders. And the fact that isolation is part of the treatment for the COVID, this is something that we have to deal with. And it's interesting in this article, they talk more about the blame game than they do about the real issue, which is the social isolation and depression and anxiety that goes along with it. And this article takes opportunity to talk about the fact that some of it is a result of the COVID policies, but those same COVID policies have saved lives. And so I'm not all of that impressed by the negativity of this article, but more impressed by the fact that social isolation and social media are two things together that have caused havoc on the American population and on the world, as a matter of fact. And so as we try to help those who have been so adversely influenced by these isolation policies, we have to get them back to communicating with others. And of course, the damage that has been done by the social isolation and social media is difficult to undo, but nonetheless, it is something that we have to be aware of, the fact that communication between others is helpful. And so now that the epidemic has gone from pandemic to endemic, it's time for us to really get back to living life and staying in touch with others. I think that's really the take-home message. This article tried to blame everything on our own policies, and it's almost as though we didn't have COVID, but we did have COVID, and the steps of dealing with COVID caused us to change our behaviors, and some of those changes caused us to have negative consequences. But it's not like we didn't do it for a reason, and like we didn't do it for a good reason. But I think it's important to realize that loneliness is something we had before COVID, but it was intensified and magnified by the policies that were put in place. And now that the pandemic is gone, it's time for us to go back to seeing our doctors, go back to seeing each other, and cutting down our reliance on social media, which has many negative consequences. Any comments on this article? If not, I think let's go to the next article, which is less dealing with the blame game. It's interesting that one of the things that is very common these days is not so much dealing with the cures of ills, but or the prevention of ills, but in blaming people for things rather than trying to solve them. And I think that the more we talk about preventing the need in the first place and healing ailments, I think the better off we are. Now, this is an article that just talks about that COVID has devastated the United States and the world, and that our life expectancy is not lower than we ever thought it would be. Although it is clear that we suffered from COVID more than any other country. More than 1 million deaths in the United States alone. There have been about 7 million deaths from COVID across the world, but we had more than 1 million, more than any other country. And as such, it has devastated our life expectancy. Most countries have life expectancy well into the 80s, which ours has actually dropped down into the 70s. So this then, of course, is frightening to all. And so we have to try to start doing those things that help us to have a long life expectancy. Restoring the exercise, I think those are part and parcel of it, along with what we talked about, having and it's interesting that other countries have not experienced the same decrease of life expectancy that we have, but then they haven't had to. And it's kind of embarrassing that we're one of the richest countries in the world, but yet have such relatively low life expectancy. Although it certainly is far better than it was 60 years ago.
Well,
But
I would suggest
still,
one of the reasons why we have worse health.
in populous countries, which is pretty bad. Expenditure for healthcare.
Go ahead.
One of the
We can't hear you.
Oh, can you hear me?
Yep.
Now we hear
Yeah.
you.
Okay. I would suggest one of the reasons why we have worse health outcomes in the United States is because, let's see, in comparison to income, we have the cheapest food in the world, but probably the worst food in the world. A lot of U.S. food products are banned in most other countries around the world, including prepackaged ground beef, any United States pork, United States chicken, United States corn, United States milk. It's those are just a few of the products that are banned around the world. For example, with United States chicken, it's washed in chlorine, and that's the main reason why other countries ban it. But yeah, I would, as I mentioned before, other times, our food processing is very problematic to the rest of the world. But it keeps the price down, and so we have low prices and we enjoy our groceries.
And the fact of the matter is that these are all issues that matter. And it's kind of ironic that as rich as we are, we have a relatively low life expectancy. And of course, this does not even address the fact that we don't have healthcare that is thought by the World Health Organization considered a right. We don't have a right to health care in the United States. And of course, that's one of the greatest criticisms of the United States, is that healthcare is not a right. That we have institutionalized racism and other issues that result in good health not being a right in the United States. That's something that I'm hopeful that we can address in the next few years. Our initial efforts have failed, and so I guess we have to try again to constitute that. It's going to be interesting what happens with the next election to see whether we take another step forward, or we go backwards.
Oh, my.
Any comments? Additional comments?
Dr. Callander, getting back to Darryl's point, this article doesn't talk about the poor food conditions. It mostly talks about other stressors. As you mentioned, institutional racism and politics and things like that. But in the disadvantage of the health system, the disadvantages, talks about all of those things. But as Darryl was saying, this article doesn't talk about food at all.
Right.
But I think, having said that, food in general can be brought up under, politics, might fall under politics, because sometimes, the poor neighborhoods have second and third hand groceries, where the rich neighborhoods have first class grocery stores and so forth and so on. So
Correct.
it's an issue that you can't put your finger on one thing.
Maybe you can, because if you go back to a certain point, and I believe, up until a certain point, we were leading the world in longevity. Now we're falling behind. And I believe that point coincides with the rise, with changes in food products in the United States. Processed foods, that hit the ground running along with Swanson's TV dinners in the 60s. And the amount of processed food has just been increasing exponentially since then. When you look at the rise of pesticides, antibiotics, and growth hormones in our foods, those are things that really took off since the 80s. But since those things have taken off, and those are the main reasons why a lot of food products are banned, a lot of United States food products are banned around the world. But since those things have taken off, we eat a lot of things, we take it for granted, like farm-raised salmon, which is very carcinogenic. So, there's not a lot of media pushback against the quality of American food. And like you mentioned, John, about our politics, if politicians are getting campaign contributions from the food industry, there's never going to be, just like the NRA, they're not pushing gun control because they're paid not to. They're not pushing more quality regulation in food products because with campaign contributions they're paid not to. And so there is a definite tie-in with politics. But I think it's unfortunate this article doesn't talk about the impact of American diet and the food industry on our longevity, but I think it's a very strong factor.
Well, I think it's multifactorial, and I think you mentioned many of the factors that are important, but they all play a role. Let's go to the next one, next article. I think one thing that we can say is that in this group, we have emphasized the importance of diet as well as exercise.
Yeah, the article doesn't talk about Americans being sedentary either. You know, lack of exercise. Doesn't talk about that either.
Right, it's many factors, so.
Okay. So I'm looking for the next article. 1 second, please. The next article is coming up.
This is a tragic. This is a tragic article in many ways that we talk about the technology being wonderful, which it is, but it also is responsible for some egregious mistakes. And this talks about a telemedicine vendor that sent letters to about 400 patients indicating that they had cancer. And actually, this was incorrect. Can you imagine receiving a letter telling you that you have cancer when you don't have it? To say it's anxiety provoking is an understatement. So this, of course, is something that you'd like never to happen again. Once the information goes out and you've been damaged by it, how can you take it back except that to promptly identify that it was an error? Of course, this is something that was a mistake, and humans make mistakes, and so does technology. But a mistake like this, telling people you have cancer because you've done some gene sequencing tests, is frightening.
You know what? I wonder whether this Grail Incorporated, you know, a telemedicine vendor, I wonder, you know, those letters were automated and they were sent out. I just don't understand how that happened. I really don't.
Well, wherever you have great improvements, you have great mistakes as well. And so the only difference is that you reach 400 patients instead of 4. And they've corrected it, but you haven't corrected the anxiety and the horror that 400 patients have experienced. At least it's temporary because you can write them and tell them, well, it was a mistake. But that is something. So let's go to the next article. It's just
yeah, one other thing about this. Back in the day, we used to say that whatever if you put bad stuff into the computer, bad stuff is going to come back out. You know, input, output. And so it's most of the time, I believe it's human error. I don't know what the rest of you guys think, but
Well, this time it was a technological error.
what do you mean?
Well, the machine sent out the letters.
Yeah,
Yeah, it's a
but
software
it's
error. So the way they wrote the
Yeah.
code
but who
incorrectly
wrote the
sent letters.
code?
They
I
said they
mean,
had, yeah, that's the problem. There was a problem with writing the code, is what they're saying.
yeah. So
So it wasn't a matter of, you have the code that's set, then you have data input. So there wasn't data being input that produced a bad result. It wasn't garbage in, garbage out. The code that was the structure for the software had a flaw in it that generated the letters. So they say they fixed the flaw. Now you put the data in, which are the test results, and you should get good results going forward.
yeah, but my bottom line was about the fact about human error.
But that wasn't human error. That was a
Well,
code error.
yeah, but humans write the software.
Okay, let's go to the next article. Okay,
Mhm.
we,
You
we can.
don't the humans write the software?
Well, yeah, okay. That's one way of looking at it. Yeah. Now this is an interesting finding. Whether it's going to stand up or not is another question. Is that, as we know, we are having an almost epidemic of early colorectal cancers in people who are under the age of 50. And one of the things that this article is pointing out is that those people who use aspirin uh, were found to have a lower risk of early onset uh, colonic cancers. Whether this is coincidence or cause, it's certainly something that has not been identified before. And because of this finding, uh, it's going to make people think twice again. We talked about taking the aspirin because of prevention of thrombosis, but then we found that aspirin also caused bleeding. And so the number of people who were taking aspirin decreased, but now with this finding, it may well lead to, younger people anyway, to people taking aspirin to prevent colon cancer and the adenomas that change into cancer. But it's an interesting finding. Whether it's going to be something that's going to stand up for the long run, they have adequate data. So you're talking about thousands of patients. So, but over time we'll be able to tell. But anyway, it was provocative enough to get the information out that aspirin is associated with decreased incidence of colorectal cancers, which had never been reported before.
Dr. Callander, I think aspirin is a double-edged sword too, because I've been hearing lately that somehow aspirin has a negative effect on the stomach.
Yeah, because aspirin doesn't also increase, it affects the platelets and it causes bleeding as well. And the reason that you have the aspirin that is protective, that is not released in the stomach, but is released in the intestine, is because aspirin gastritis is a common side effect. And for those people who have that, they have the aspirin that is not released until it gets past the stomach into the intestinal tract. But it still does affect the platelets and is associated with some increased incidence of bleeding. So you have to balance all of that with its side effects. So yes, it is a double-edged sword. It's good, and it also has side effects that aren't so good. So whether you take it or not depends
In
upon.
my position, can't seem to make up their mind. Some are saying take the aspirin, some are saying don't. I don't have to take it anymore because they use it as a coagulant, maybe a blood thinner or something too, don't they?
Yes. Yeah, it has its side effects. So you have to weigh the balance. It's a balancing act. Are you afraid of the bleeding? And that's why many of the studies that looked at heart attacks and so forth balance it with the incidence of bleeding. And so, yeah, it may prevent some strokes, but it may cause some other strokes. So it's, as you mentioned, it can be a double-edged sword. And so it's recommended that you really talk with your doctor about whether or not you should take it. But this is a new finding in which aspirin and NSAIDs actually decrease colon cancer. That was not thought about before.
I would like to ask Mary Ellen, was your dad taking aspirin?
No, my dad wasn't taking any medicine except for glaucoma.
Hmm.
He went from eye drops to chemo.
But didn't he have, at one point he had colon cancer?
Yeah, he had colon cancer, and he had it. He had it. He had the surgery, had it removed, had a colostomy, and then before he died, they were thinking about reattaching him. But no, he never took any medicine except for because he didn't have high blood pressure or high cholesterol or anything. He didn't have arthritis. He wasn't having pain anywhere. He went from being, super healthy to super sick.
How old was he?
He was 90. He was 89 when he got colon cancer.
I see.
And when he died, he died at 93.
He had a long, healthy life then, huh?
Yes, he did. Yes, he did. And I've been skating by. The reason why I've done well is I've gotten some of his good genes, but I had worse habits. He never drank or smoked either. And his weight was always, he was lightweight.
Okay. Let's go to the next article, man.
Before we get to the next article up, I wanted to ask a question about the exam for colon cancer. They have this new thing out called Cologuard. Have people heard of that?
Yes.
Yes.
Okay, so how do people feel about Cologuard?
It's all right, but it doesn't replace colonoscopy.
Uh-huh.
Because if you have a positive test, you still have to have a colonoscopy. If you have a negative test, I think it's helpful. As a screening test, it's helpful.
Yeah.
I don't think it replaces colonoscopy, but it's a test for people who don't want to have colonoscopy, and if it's negative, that reinforces their desire not to have it. But that doesn't eliminate the fact that you could have adenomas in the colon. But it's a test if it's negative, and you decide you don't want to have a colonoscopy, it reinforces the idea that you may not need to have it.
The doctor told us, my brother and I, that we need to that Cologuard is not good for us because we're high risk.
Yeah, if you have a family history of a cancer, then it's not recommended. Now, this is an article that there's been a lot of interesting publicity about organs and that the allocation system is good, bad, and different. And one of the things that has come up is that the allocation system is problematic and it's responsible for deaths of some patients. Actually, the truth of the matter is that the number one problem in transplantation isn't the allocation system, it's the shortage of donors. And it's this shortage of donors that results in close to 17 people dying every single day because of this donor shortage. Now, the allocation system is an attempt to try to maximize and associate those people who are on the waiting list with organs so they can get a successful transplant. And so this article just points out that as a consequence of this system, more people are getting organs, but that's still not enough to help with the disparity between the number of people who are waiting for organs, which is close to 100,000, over 100,000, the number of people who actually get organs, which is around 40,000. So you got that big number of 60,000 gap, which is the real problem. And so until we get to a system that allows us to have grow organs or use organs from animals and other things, we have to recognize that the shortage of donors is the biggest problem. However, the fact that this allocation system is increasing accessibility to organs is positive. So I just wanted to put this in there because there have been a number of articles that, to me, unjustly try to blame everything on the allocation system when the real problem is the shortage of donors. That is true for all organs, but particularly kidneys, where the longest waiting time is associated. Waiting time for kidneys, if you want to have a deceased donor transplant, ranges from 4 years and upwards, which is why living donor transplantation is the most desirable, because you don't have to wait so long. And also the incidence of graft acceptances is higher. But I wanted to put this in there just to balance the scale a little bit, because we've seen a lot of articles recently that talked about the fact that the allocation system was really the problem. When in point of fact, the allocation system is maybe to some degree, but the biggest problem is the shortage of donors. You can go to the next slide. I just wanted to make that point. Any comments about that?
Dr. Callander.
Yes.
Um, there are a lot of ethical donations are concerned. I know I've heard a lot of bizarre things about making prisoners donate
Not in the
organs
United States.
and paying. I know, and paying people. No, I'm saying I've heard discussions paying people to. But there are There are not too many altruistic people that will give donors. That will give organs. And even when they do give organs, you don't want the person to meet the person that gave them the organ, because sometimes that's bad dynamics. So it's all kinds of kind of sticky issues with donor retrieval and acceptance.
Well,
How
I don't agree, but I don't believe.
I don't agree either. I'm saying all those things are bad, but I'm just saying, how do you get past that?
Well,
How do you get past that and encourage people to do it with no reward other than a thank you?
well, that's all we.
Because
Well, okay, that's all that we've ever had, and
right,
I think that it remains altruistic, and we want it to stay that way. As a matter of fact, uh, it is illegal in the United States to buy and sell organs, and
right.
that's where we want it to be, and we
I
hope
think
that it
it
stays that.
should be. I think it should. I think you're correct, but I don't think people are as good as they should be.
Well, I think I actually am surprised that we have so many. We actually have a significant number of altruistic donors who actually come forward and donate. Actually, to me, I'm surprised we have so many. But because we do have people who come forward and offer their organs to anybody who wants them. And the fact that we have some is positive from my perspective, because people aren't as selfish as you might think. And so to have a number of people who come forward to do it, and we do have a significant number of people who actually come forward and donate because they think that the reason they have two kidneys is because one kidney can be used to be given to somebody else. Because that's only true if you have normal kidneys. A lot of people who have kidney disease, particularly a lot of Black people who have kidney disease, and people who are over the age of 50. So, but the ethical issues that exist in transplantation are more prevalent outside of the United States than they are inside the United States, because the donor issue is in the United States is kept free of payment.
Mhm.
Outside of the United States, that's not the case. So many people will leave the United States and go to other places where there is the buying and selling of organs.
Well, like they say, you miss 100% of the shots that you never take. And so the flip side of that is the more that you encourage donations and dispel erroneous myths about the donation process, the more likely we are to increase the number of possible donors. So, things like people believe that if they donate, they can't get into heaven, or that, there's some type of harvest program that they take your organ before you're dead to kill you to get your organ. Those are misconceptions that people have, and so they get the right information, and plus that they have a chance to do a good thing with their bodies when they're gone. And it's a good thing if we just it's information. The more people that are educated about the process, about a possibility of doing a good thing for their fellow man, of being altruistic, then you can increase the number of donors.
Well stated. This is an article that talks about something that we just found out, that COVID positive donors can be transplanted without concerns about getting COVID. Of course, now that COVID is less a problem, but During the COVID pandemic, many people received positive COVID donors, but they didn't realize that until after they had gotten a test back, and those people who actually were COVID positive did as well as those who were not. So one of the things that we learned after the fact is that COVID-19 positive donors are safe to use for transplantation. There's no increased risk of rejection, no increased risk of kidney failure, and so anyway, this just lets us know that there's no fear of getting COVID from COVID positive donors. More education and information goes right along the lines of what Darryl Armistead just said. Okay, we can go with the next article. Any comment or discussion about this? I was surprised that this is the case, but as we live, we learn, and we take advantage of it.
Dr. Callander, I would think that it depends on the severity of COVID, because we're talking about some people who have light COVID and severe COVID. Haven't we talked about that before?
Yeah, but the data shows that it didn't matter whether you had light COVID or not, that the virus was not transmitted via the organs.
I think oh no, we talked about that article before. Hold on one second. I'm looking for an article that we haven't discussed yet. We talked about okay, there were two articles on aspirin lowering the risk for early colorectal cancer.
Okay. We don't need the second one.
Okay, all right. Well, that's all the articles.
Well, there was an article I sent you about chronic constipation.
Chronic constipation.
Yeah.
Which
is a subject that we're going to have a talk about in about 2 weeks, because we have a specialist who's going to talk to us. But it's a problem that occurs in the people over 50. It's very common, and probably all of us on this podcast have had constipation at one point or another.
Mm-hmm.
And it talks about the different treatments for constipation. And there's new guidelines. As a matter of fact, that's what this article was on the new guidelines for constipation. And one of the things that probably is as important as anything else is a proper diet, and having enough fiber in your diet is probably one of the most important aspects of it. And of course, if for some reason you don't have enough fiber, what is constipation? How and when do you consider it constipation? Is it constipation because you haven't had a bowel movement in 24 hours? Is it constipation because you haven't had because you have hard stools? Is it constipation? And for the most part, the article pretty much considers it as constipation if you don't have movement for 48 hours or more, or if your stool is hard. I have a number of people who in spite of the fact that they try to take stool softeners and they take medications for constipation, they still have this as a problem. Any of you have any what you call solutions for avoiding constipation? Because when you look at it, theoretically, you should have 1 or 2 bowel movements every day. And when you go beyond that, then of course it's not frank constipation, but it's not healthy. And when you have hard stools, then they come out, they can cause cuts in your rectal canal. And so avoiding it is important. So having a high fiber diet and ensuring that your bowels move at least every other day becomes important. Now, there are people who actually have addicted to laxatives because they don't eat a lot of fiber and they don't have bowel moves regularly, and so they have to take laxatives every day or every other day. What are your thoughts about that? Because I think this is a common problem of people over the age of 50.
Okay, well, I'm over the age of 50. I'm 74. I've been vegan for 20 years. I get 6 servings of fruit a day. I avoid bread and dairy. Well, of course, no dairy products goes without saying for being a vegan. And I go twice a day, if not 3 times a day. I never miss a day. No hard stool. Always an easy go. No straining.
Anybody else who has that kind of healthy bowel habit?
Nobody else.
Is that because you don't eat that much fruit? Is that what?
I eat fruit. Just nobody else is that regimented, I don't believe.
Well, he's a great role model, I tell you
Yes,
that.
he is, but my diet, I know, is probably some of my problem. I don't, I like dairy. I eat a lot of ice cream. I eat a lot of chips. I eat but I always keep prune juice in my refrigerator.
It
So
works well, huh?
it works very well. So so if it gets to be over a day or so, I'll just drink a little can of prune juice and keep it moving.
Any other comments?
I think drinking a lot of water helps. Being hydrated helps.
There again, I don't drink a lot of water. I drink a lot of things, but I don't drink a lot of water, which is not good, I know.
I saw somebody's lips moving, but I didn't hear any words. Did somebody
Dr.
else?
Callander,
Yes.
I take my calcium receptors were damaged when my thyroid was removed for cancer. So I have to take lots and lots of calcium every day. So as a result of that, even though I eat about 4 pounds of greens a week, I eat about 4 oranges and 2 apples a day. I still have constipation, so I use a stool softener every other day, and that helps me.
Which stool softener do you use?
I use Ducalax. It's a new one, and you
It's
chew
not
it.
new. That's an old drug.
Well, it's a chewable
Okay.
one,
All right.
not the pill.
Okay.
But it works well. It works well
Good.
for me. But that's my bane of my existence is the constipation. But You know, that's if that's the worst thing that happens to me, I'm doing good.
Any other comment about constipation? And
There's medicine that you can take that will help keep you regular.
what medication are you speaking of?
For me, what helps a lot is my magnesium intake.
Okay.
Yeah, that helps me.
And of course, one of the, interesting enough, two of the laxatives that they mention are magnesium products, magnesium sulfate and magnesium oxide. Right. So,
Yep. I take magnesium. I used to take magnesium oxide, which is good, but now I take magnesium glycinate,
okay. All right.
which is also good.
Okay. Well, you have a number of varieties of ways of dealing with, and I think we've heard at least 3 or 4 different ways of doing it. Although Darryl's was most impressive. Effortlessly twice a day. No strain. Well,
Well, it's even more efficient since I started using the squatty potty. Um, I forget which doctor suggested that, but yeah, I love my squatty potty, and I even have a guest squatty potty in a guest bathroom.
oh, really? Hmm.
Yeah, so if you come to
Okay.
visit and you need a squatty potty, you can try it out.
Okay, Darryl. All right. Okay. Well, I think that we have, I think June the 22nd, we're going to have a presentation by a colorectal specialist who I've asked to talk specifically about constipation, because I have a number of patients who, in spite of taking, well, of course, they don't stick to the diet that they should, but they have problems with constipation and hemorrhoids and other kinds of issues that crop up when you get older. It's interesting when you read the Bible, you read that that one of the plagues was hemorrhoids. Yeah, and how that plague was problematic to many. But and we don't talk much about, when we talk about many things, we don't talk much about hemorrhoids. Have any of you ever had hemorrhoids?
They're
No,
horrible.
no.
Yeah, pretty common, and
They're horrible.
yeah, yeah, yeah. So, and of course, there's so many different treatments for hemorrhoids. Of course, preventing them by Darryl's kind of diet prevents hemorrhoids from occurring. But when they occur, they can be treated by surgery or by different medications. Okay. Any other comments or questions?
I just wanted to, I wanted to show you, I presented all the articles that we had for the month of June that I was able to capture from my email. But of course, when you went to your grandson's graduation, there are articles that we have missed. And so if you don't mind, I just want you to
Okay.
take a look at some of the articles that.
Yeah, we got time for about 3 or 4 more.
Okay, so let's take a look at some of the past articles that maybe we have not gotten before. So give me a second and I will show you.
While he's,
Here we go. We got it. So now, if you look at the dates in this column, all the ones in June we did today. And the ones in May, I remember talking about some of them. For instance, the man who had paralysis and they put an implant in his brain and he was able to walk. But if you look at May the 28th, and May the 24th, Dr. Callander, have we covered all of those? And other people can chime in too.
well, let's look
can't
at
see
Bob Chelsea, May 24th.
Okay.
Yeah. This is the first African-American 58-year-old male who had a face transplant. And he has been so excited and has praised God for the fact that he has received a face. He was in a fire and lost his face. And after having turned down one face transplant, received a face transplant from a donor. And he's blessed to have had 3 years since his face transplant, and he's been so enthusiastic and grateful for his face transplant. Now, what's different about face transplant is that, when you have what they call the new plastic surgery, is that you have to have a special permission to donate a face, and then if somebody offers you a face, then you have the option to accept it. The first donor he felt the complexion was too light, so he turned it down. But the second one was a match for him for his complexion, and so he accepted it. And so now he's 3 years after the transplant and doing well. He's still also the oldest face transplant recipient. Right now, we're doing composite vascular allotransplants of the penis, the uterus, the hands, and the abdominal muscles, the penis, the uterus. We've had close to 30 live births as a consequence of uterine transplant. So this is another type of we're now doing called composite vascular allotransplantation, in which we and the other organs that we mentioned. Any comments or questions about this marvelous?
Yeah, I just read that. It says, generally the donor in facial transplants are brain dead but still have heart function. And the face transplant recipient arrives at the hospital where the donor is being kept and preps for the surgery. So I thought that was interesting.
Yeah.
Right, and most of the deceased donors are donors for whom the heart is still beating, but the brain is not
John,
alive.
Is this the picture in the small picture to the right? Is that the face after?
Really?
Oh,
I'm looking, I'm gonna try to see if it pulls up.
This will be gone, Ma.
okay. I was just wondering whether that was his face after the transplant.
I think so.
Mm-hmm.
I think so.
Oh, wrong map.
I was waiting to call you.
Yeah, let me get back to that.
I've met him and
I don't eat yet. I just ate some candy.
he looks. I didn't really
That's all.
think he looked any different from anybody else. So
Well, that's a good thing.
yeah, yeah.
I still have time to play for him.
Sorry,
Put the apples in.
I didn't hear the question.
The one that- when I go down to-
No,
Some background noise.
That's,
Yeah, I wasn't able to enlarge the picture, I don't think. I think that's it. I wasn't able to enlarge the picture there, but I do think the one on the right, I do think that was his last picture there. This one here. Can you see that? You don't see it yet. Hold on.
Mm.
I do believe that last picture on the right is the final picture, yeah. Now, I imagine Dr. Callander, you were saying about the permissions on both sides of the fence to get a facial transplant. In other words, you said the donor has to give permission.
Special permission. In other words, the normal permission that you give when you sign a donor card and those kind of things is not suitable for composite vascular allotransplantation. So if face transplant or penis or uterus, you have to have special permission for that because that's separate because it's more complex. So you have to have a special consent form for that.
So I imagine that the social security number gets involved too, I guess.
No, I don't think so. No, it has nothing to do with it. Let's go to another article that you want to pull up.
Okay.
He is one of the most enthusiastic people I've met to organ transplant recipients are very enthusiastic, but as a face transplant, he is overjoyed at the fact that after the burning and all that, he could have his face back.
Okay, that was May the 24th.
Yeah, there was an article about preventing breaks and falls in older adults.
Oh, that's
May 24th.
you talk about this one here.
No, the two slides above it. Or do you want to go to the doctor's 8 secrets of staying young or preventing falls, breaks and falls? Which of the two do you?
Oh yeah, this one and that one. Yeah.
Yeah, maybe we'll do both of those.
All right.
Preventing breaks and falls in older adults. Go up two. Yeah, that one. Yeah. Okay. This fits right into our article we talked today about osteoporosis. And they talk also about the fact that mostly women and older folks have osteoporosis. And the article goes on down to talk about what we mentioned today already about the fact that this leads to bone fractures. And it talks about also sometimes people are reluctant to use canes to get around because of their egos. And some even have to use walkers. And they feel embarrassed by the fact that they have to use these aids.
Mhm.
And it points out that using these aids can give you confidence and keep you from having an additional fall. And so the psychological effect of these aids is something that people have to deal with as well, in addition to the visual problems that you have. So one of the things that you have to be aware of is that what is their vision? Because if they can't see, they'll fall. If they fall, they break their legs, and
Mhm.
what happens after that is not pleasant. And it talks about grab bars and showers and rugs that aren't right side. And then, of course, the importance of exercise and building up the muscles. Yeah. Confidence is a major fact. Then, of course, the medications, when we talked about the calcium and the vitamin D, if you have osteoporosis, phosphonates, which is part of the therapy for osteoporosis. So this then is also there are ethnic differences in who falls and all that, but I think the issue is that some people are reluctant to take some of the medications for a number of reasons. And I think another article called it a bone attack and considered it like a heart attack. That was true as well in the previous communication. Because when you fracture a bone, if it's not taken care of and you're not up and about pretty rapidly, this can lead to pneumonia and lead to death. So those people who have these kinds of fractures often within 2 years are gone. And so it's important to get up and about as quickly as possible.
Dr. Callander,
Yes.
at one time, they were promoting Fosamax, and I know one time I used to take it every month, and then was that because of um they found out that it wasn't doing what they thought it was doing?
Well, I don't know what Fosamax is, but the biphosphonates they still use. I don't know exactly what Fosamax was, biphosphonate as treatment.
Judging by the name of it, it sounds like it's probably one of those medicines.
It might be. I don't know, but I know the biphosphonates is still one of the key therapies they use for treatment of osteoporosis. Okay, I'll go to the next one, next article.
Okay, let's see what we got here. All right, so that was preventing breaking fall. The other one is the rate of falls among seniors. You want to go there?
No, there was another one that there's another article.
This is one is preventing, and this one is the rate.
No, there's another one. There was another one I was looking at that different.
Okay.
Oh. while John is looking for the article, I have had 2 hip replacements, but I never had a fall or anything like that. So does your hips just wear out?
Yeah,
Or what
arthritis
is-
that they're having, the pain they have in the joints.
Yeah.
Is that why you had joints?
I had pain. I don't remember them saying I had arthritis, but I
Well,
guess
yeah,
that's
that's
what it was.
except
That's
it's
what
the
it
pain
was.
in the
Okay.
joint that requires the hip replacement.
Yeah.
I have a friend of mine who was 92 who just had a hip replaced, and she's doing very well as well. And the key, as you know, is getting it done and getting up and about and getting physical therapy thereafter, because that's the key to success.
Yeah, yeah, the pain is gone. That's the main thing.
That, right. That makes it all.
Yeah. After you get organized, it's over.
Is this
You
got the article now? So you go to that and then I'll ask.
you're back to no. Ask your question.
Okay.
We were in
Oh, yeah.
May of 2023,
March, yeah.
John.
My husband having some pain up around his neck area and in this area. He just wondered if arthritis can get in any joints or any pain area.
Yeah, just make sure it's not a heart attack, because sometimes current any joint can cause pain, but if it's on the left side and it's the jaw, if it's on the right side, that's less likely. But if it's on the left side, then one of the differential diagnoses is cardiac. But arthritis can occur in any joint, whether it's the cervical, the neck, or the mandible, or so it can occur in any joint. But when you have it on the left side, you have to be sure that it's not the heart. John, we were able to find that May. It was a May 25th article.
May, I've got 2 articles about falls in May.
No, but there was, there's another article that was different. Not about falls on the topic.
What was it about?
I can't remember, but it was
It was between the 2 articles about
right. It
fall.
was between the 2, yeah.
Oh, okay.
Between-
All right. Let's see what we got here. It was the 8 secrets. That's
Yeah, that's the one. Yeah,
okay.
8
all right.
secrets.
8 secrets. All right, I got it.
Not that we need those. I mean, we got Darryl to tell us how he's at 74 and looking like 54.
But you one of his exercise. I bet you. Wow.
Is 8 secrets staying young?
Mhm.
Well, he's got nothing on us, huh?
1 second. Okay. If the advertising. All right, there we go.
Okay, and I guess we all know that staying physically and mentally fit keeps you happy. And I think getting older, the issue is to have a quality of life. And so he's sharing some of his, as you go down.
Okay.
Yeah, go on.
Yeah, I was trying to get rid of that advertising, but I'll go.
Don't worry about it, just go down.
Okay.
Yeah, and he talks about very similar about the skin, and I think we talked about this actually, and we talked about the skin blocks and the UV rays, and I think we spent a lot of time talking about this skin damage, and of course, with this haze, the sun can cause a lot of UV damage if you don't have uh,
Sunblock.
sunblock, right? Yeah. And the next one is, you can go down to the next one. And we talk about this all the time. So that most of the 8 things that they're talking about, we are doing exercise, of course, the 150 minutes a week minimum, along with lifting weights. That's the part about as you age, your muscles weaken. And so lifting weights is important to do. How many pounds do you lift, Darryl?
Well, it depends on the routine. Uh, let's see. I alternate. Like say, I lift weights 3 days, take a day off. Day one is going to be chest and biceps. Day two is going to be shoulders and back. Day three is going to be legs and triceps. And so, um, let's see, like say with bench press, I'm normally doing bench press 80 pounds. I'll do 3 sets of 15 bench presses a set. So I'll start off at, I'll go 60, 70, 80 pounds. Um, well, but there's a lot of exercises I do where I'm using as low as 10-pound weights to start off with the warm up. I'll go like 10, 15, 20. But yeah, it just depends on probably the max weight that I use is on squats. Um, I got a squat bar, and so for that, I'll do 120 pounds on a squat. Uh, but it's let's see, I would say that all of my lifting is it's about a third less of what I used to do 10 years ago. Um, you know,
Okay.
with less risk of injury, I was kind of running it close to the edge, but now I don't have to.
Okay. And the next item is eating wisely, which is they emphasize the same things that Darryl always emphasized: staying away from processed foods and sugars. They don't emphasize. They emphasize the plant-based food, but they don't emphasize staying away from dairy. But other than that, they emphasize the vegetables, fruits.
There's a YouTube channel run by a Dr. Bobby Price, and he's a black medical doctor, and he talks about nutrition. That's the basis for his YouTube channel, and he puts out probably about a different uh, couple of different shows each week. But it's it's not telling me anything new, but it's kind of like solidifying information that I already had. But I highly recommend him. He's a black doctor, looks to be about maybe 40 years old. But we don't crack, so he could be 60. He could be 60 for all I know. But yeah, I encourage everybody to check him out, Dr. Bobby Price.
And then the fourth item we have is substance abuse is a major no, which There's so many substances that are abused nowadays. So. But of course, nicotine was the commonest one. But of course, alcohol.
That glass of wine looks delicious right there. It looks like red wine and it looks like it's sweet.
And then talk about getting the appropriate screens. We talked about the colorectal screening and the prostate screening and the mammogram and the
Pap smears.
pap smears. What we sometimes don't emphasize is the fact that you should take your blood pressure readings at home with your own sphygmomanometer. And also the fact that you should have, after the age of 50, you should have a urine protein analysis. Because many of the people of color over 50 have protein in the urine, which means kidney disease is coming. And that can be reversed or prevented from progressing by recognizing it and taking medications where necessary. Condition. Then, of course, the vaccines. One of the things now, of course, is the herpes. I'm sorry, the herpes. Anybody over 65 is supposed to get, in addition to COVID and flu and the pneumonia bugs. And then he says have a positive attitude, which I think is always important. But I think as important as meditation. Meditation to me is just as important as physical exercise. So it's the same amount of time. Actually, I think I spent, so they both come hand in hand. Realizing that your genetics are important, but that more important than your genetics is your lifestyle. And if you take supplements, medications, you should be sure that your doctor is aware of what you're taking. So he's not blindsided. It doesn't mean that you shouldn't take them. It just means your doctor should know about them so that the medications he prescribes do not conflict with them. So these are some of the tips that we've actually already discussed, but I guess it doesn't hurt to discuss them again. Any other comments or additions to these that you want to give us? It's interesting. He says there's no anti-aging pills. There aren't, and I think that actually these suggestions you've given are actually anti-aging because living long is important, especially if you have a quality of life as you live long. And so these tips, I think, are helpful. Any other comments or additional ones you want to mention that we haven't mentioned in this article?
They advertise metformin a lot on TV.
Say what?
This metformin.
The diabetic medication, yeah.
Yeah, they advertise it a lot on TV.
Yeah, and therefore what?
And so is that one of the medicines that has anti-aging property?
No.
Okay.
It's actually a good medication for diabetes, but I don't think there is such a thing as anti-aging. And he talks about a lot of our research is going into rapamycin and these other drugs, but they don't really have any demonstration research-wise that these actually are anti-aging. There's a lot of articles on each and every one of these, but to say that they are actually anti-aging is a stretch. But so much so that at least he includes them in the category of anti-aging, but there isn't objective research that allows you to say that any of those 4 drugs have been proven to be anti-aging. And in order to be anti-aging, you would have to have something that really affects the telomeres and lengthens them, because what happens with the telomeres is they get shortened, and as you shorten, your aging increases. And there isn't sufficient evidence yet to say that metformin, rapamycin, which by the way is a immunosuppressive drug that we use for transplantation, whether any of those that they mention are actually anti-aging drugs, but they are. I remember one of our, it's 10:30, so I guess we should close, but I remember one of our guests was also involved in the RSV research. Were any of you involved with that? That the new
I'm in a
vaccine?
study.
Yeah, you're in that study. Well, apparently it's been effective, so that the vaccine is now available.
Yeah.
So,
Yeah,
were
they
you?
gave me the vaccine and now they're,
It has now been approved.
mhm.
So apparently, this is the first RSV vaccine. The previous vaccine attempts failed, but this recent one that you were involved in was successful, and so now that vaccine has been approved by the FDA. Any other comments?
Is that for
Go ahead.
children too? Did they approve for children or just adults?
That was approved for adults. Yeah.
What's it for? What's the vaccine for?
The respiratory syncytial virus,
Oh, okay.
which is a cause of type of pneumonia in elderly and very young people.
Okay.
But they did the research on the adults.
So Marilyn, you were taking it and your doctor told you to stop?
No, they gave me, I'm in the study for the RSV.
Oh,
They
okay.
gave me the shot and then I have to, they check me every month and ask me about my, how I feel and symptoms and stuff like that. But they gave me the shot.
Yeah, she's one of the people who now has made it successful, so that it is now FDA approved. Right. So thanks for your efforts.
Yeah,
You're very welcome.
thanks for your service. Do you are you gonna start taking it and they're gonna give it to you free since you were in the study?
Well,
No,
I
she's already got
it.
it.
I already had it.
She already has it.
I
Okay.
already had it.
Right. She's the reason why it's successful.
Right. And she got some money.
No, they don't pay you for that, do they?
Yeah, they do, but not much.
Oh,
Yeah, McDonald's money.
Well, car fare for me, $80 a month.
no, it's not bad. Yeah.
Yeah, that's more than my retirement. So
Is it a one-time shot or is it a yearly shot that you get?
No, it's a one-time.
One-time shot.
Yeah.
Very good.